Hey, I'm Dr. Mandy Steele. I'm here to talk to you today a little bit more about dry eye patients, how to help them understand their disease efficiently, and all the treatments that are coming their way. First and foremost, let's talk about how you talk about dry eye to a patient. You have to help them understand there's a chronicity to this disease. It's not going to go away tomorrow, and anything we do is not going to be a magic bullet to fix it. They have to be their own self-advocate. It's really important that they know how to take care of themselves, to comply with the instructions we give them so they can do the best to follow through with all the things we want them to do. I do think it's important they understand it's multifaceted. It's not one thing that goes wrong, it's multiple things that happen over time that create this disease. It's also very important that they understand what a tear is, that it's multi-layered, that technically a simplistic version is best when you talk to a patient. There's 3 layers. You've got an oil layer that's made by the glands of your eyelid. You've got a water layer, aka the aqueous layer, that's made by the one little lacrimal gland I always point under your eyebrow. And there's a mucus layer that's made by the eyeball that for the most part does a pretty good job of its own. It's important they understand that other factors contribute to dry eye disease. It's important they know that the medicines they may have taken previously in their lifetime was a problem. Medicines they're currently on, diseases they may have, especially in the autoimmune family, and of course our cancer patients that have gone through treatments can have major problems with their glands, and the disease can be very exorbitant with them. Overall, it's important that we tell them there's a lot of different pieces of this puzzle. We have to solve the problem, and we have multiple ways to solve this problem. They have to just be on this journey with us as we go through all the parts. So the next thing I want to talk about is why you choose specific tear products. There's an enormous volume of tear products on the market today, and patients have absolutely no idea what to choose. The shiniest box may be the one they pick up. The one they've heard a commercial about or their friend told them about is the one they may pick up. So they have no idea where to start. It's imperative that we empower them by helping them understand why we use the tears we use, whether it's preserved versus non-preserved, how often to use that tear during the course of the day, making sure they understand that in a preserved tear, we want to keep that volume at 3 to 4 times a day. It's time to switch to non-preserved if they need it more often. And in the non-preserved world, do they need just a lubricant because they have really good tears as a whole, they just evaporate faster? Or do they need a mixed drug that has both oils and lubricants in it to make sure we help them if they've got gland dysfunction on the whole? Because obviously if their glands aren't doing their job, they've got to have oil coming from somewhere to keep the evaporation levels low. New products are constantly coming out. So be on the look. Stop in your local drugstore. Read. Look at what you're looking for. Know about active ingredients. Know which ones cause more allergy problems. Know where the problems lie so that you can help the patient solve the problem very quickly when they come in the door and tell you what drops they're using. Weed them out quickly and get to the good ones at that point in time. Finally, it's really important to help patients understand about procedures that improve dry eye health and ocular health. There's so much frustration with these patients. They're disappointed by the eyes and the chronicity of this disease. And so knowing there's a procedure out there or 2 or 3 that can help them is very, very important. There's thermodynamic procedures like LipiFlow, Tear Care, and iLux that do a great job heating the oil glands, and some do self-expression or staff can express as well. But getting these glands restarted, as I tell patients, is critical because then they have a chance to feel what it feels like to have healthy glands again and to hopefully be able to do more compliance with their warm compresses and their massage as time continues on. None of these are permanent, and that's also important to let patients know, but it does give them that longer window of relief, which is very helpful. Another great procedure is IPL, and that's excellent for patients that have rosacea and other issues where we need to treat not just the glands, but facial changes, especially vascular changes that can lead to more inflammation. Speaking of inflammation, it's important for patients to understand inflammation and understand that's also chronic. And it's not one simple fix like an infection would use an antibiotic for. So make sure you take the time to go through inflammation with them and help them understand that underlying condition, especially with rosacea patients, so they understand why things are more long-term. Finally, the wonderful things we've all used for years, those punctal plugs. It's a wonderful resource. It's very underused in a lot of cases. Be very careful with plugs. You never want to plug up inflamed tears on the eye. You want to make sure that you check inflammatory levels, or if you suspect inflammation, at least treat that inflammation initially for a period of time, whether it's a prescription medication long-term or short-term steroidal options. Solve the inflammation first before you plug, first and foremost. In the end, there's no question, as clinicians and patient advocates, it's our duty to not only educate our patients about dry eye and all the facets involved in that, but make sure they understand it, they're willing to comply with what we tell them, and they are their own self-advocate to do their best. Thanks.